So I wanted to talk about an abstract presented on the FRACTION renal cell carcinoma clinical trial. This is the first presentation of data from the FRACTION program for renal cell carcinoma. This is a larger overall program than the data presented at ASCO this year. It's a signal-seeking phase 2 platform testing multiple different combinations of nivolumab with a second agent, and it has 2 tracks, both an untreated patient track and then a previously treated patient track. And this year's presentation was track 2, previously treated patients and receiving the combination of nivolumab plus ipilimumab. And so I think a very timely presentation looking at the issue of CTLA-4 blockade in the setting of patients that have had prior therapy, including prior checkpoint blockade. So the patients in this cohort was a 46-patient study. They were required to participate in track 2 to have had prior PD-1 or PD-L1 therapy, and they have all failed prior PD-1 pathway blockade. 80% had also had prior VEGF pathway TKI therapy. It was a heavily pretreated cohort with 50% of patients having had 3 or more prior therapies. The primary endpoint of the cohort was overall response rate. And so in the 46 patients, there was a 15% response rate. The disease control rate was 52%. The duration of response in the responding patients was not reached with greater than 20 months median follow-up. And so it does appear to provide some durable effects in a minority of patients that are having a response. I think that touches on a very relevant issue, which is what do we do with patients that have failed a frontline regimen? In the last 2.5 years, we have 3 new frontline regimens for renal cell carcinoma, all superior to Sutent monotherapy as the comparator. And so the field has moved off of monotherapy with targeted agents, and most patients are being offered checkpoint blockade in some combination regimen. But if they fail that primary therapy, what are our options? And so I think FRACTION sits in a larger context of looking at anti-CTLA-4 in the refractory treatment setting. There were other presentations at ASCO this year. The Hoosier Cooperative Group study, GU16260, looked at frontline PD-1 monotherapy with anti-CTLA-4 with ipilimumab as a salvage agent in patients that were failing PD-1 monotherapy, and that study had a 13% response rate. The Titan study was presented at ESMO 2019, which had a similar format of starting patients on frontline anti-PD-1 and providing CTLA-4 blockade as a salvage maneuver, also showing a 12% response rate. And interestingly, just recently in this past week, a publication in the Journal of Clinical Oncology of a multi-center retrospective look at this exact same approach, providing ipilimumab anti-CTLA-4 blockade in patients that are PD-1 refractory and reporting a 20% response rate. So I think these studies, whether prospective like FRACTION or the retrospective recent publication, do provide evidence that it's meaningful to provide ipilimumab as a salvage agent in our patients. In FRACTION, we're continuing PD-1 blockade plus anti-CTLA-4, so a 2-drug combination. The dose and schedule were typical for how you would dose ipilimumab in the frontline setting, corresponding to the CheckMate 214 data. That is also the FDA-approved label for using ipilimumab. So it's familiar to providers about how you're dosing and scheduling your ipilimumab. So I think that's, again, a very relevant observation, does provide help to providers. I myself, my own clinic population, sometimes have provided ipilimumab as a salvage strategy, very often in patients that have had primary success with PD-1 but are beginning to fail therapy. And so anecdotally, I've seen observations very much like the recent retrospective report of patients stabilizing or having new de novo regressions in the setting of providing ipilimumab. So I think it encourages us to consider that as a reasonable option for our patients that are failing frontline regimen that includes PD-1. Well, certainly the FRACTION renal cell carcinoma program is ongoing. And as I said, this is the first presentation at ASCO 2020 of data from that program. But there are other combinations of nivolumab plus a second investigational compound. And there is data in the frontline setting, both frontline and salvage setting. So it will be a program that we come back to numerous times to provide novel data regarding combinations for our renal cell carcinoma patients. So that will be a source for future data for sure.